My name is Megan Pinckard. I will be presenting my signature project for the Master's in Elementary Education Graduate Studies program at the University of West Alabama. The title of my signature project is The Effects of Social Emotional Learning on Student Behavior in the Early Education Classroom. When a child exhibits aggression and frustration, is there an underlying issue? That's a question most teachers ask themselves when they have a student that continually acts out aggressively in the school setting. Students, especially those in the early education environment, lack the skills to cope with emotions such as anxiety and frustration. While teachers may not always be able to pinpoint exactly what the trigger is, they can find strategies to help the students self-regulate their emotions and deal with them in a more appropriate way. The following study will examine the benefits of teaching social and emotional learning in the early education classroom. Centers for Disease Control and Prevention conducted a study in 2021, and it showed that social and emotional issues are on the rise in students at the early elementary age level, especially those that are at or below the poverty line, with an average of 17.4% of children ages 2 to 8 years old. Children who struggle to self-regulate emotions are more likely to present with negative effects to their learning abilities and behaviors inside the school setting. If students are not taught coping strategies, these patterns of behavior can carry on throughout their lives and into adulthood. As students begin their academic careers and the focus of their learning shifts to more core content areas, their social and emotional learning can become a secondary focus. Children at this age level deal with daily stressors both inside and outside the school environment, but lack the proper tools to self-regulate their emotions due to their developmental level. Winmere, 2011. When young children start to experience anxiety, frustration, or stress but lack necessary coping skills, they can present with disruptive, aggressive behaviors in the classroom, and behaviors such as these impede the learning of the student in crisis along with their classroom peers, as observed by a study completed by Penn State University in 2017. So how can we help? As educators, we must shift our focus from teaching core content standards to teaching the child as a whole. In an ever-changing world, the needs of our students grows as well. When a child in the early elementary stage of development exhibits disruptive behaviors and aggression, we must look deeper into the needs of the student. All too often, these behaviors are explained away as normal childhood tantrums because of the child's age, as observed by Reby in 2005. If educators assume that young children do not have stressors or anxiety, they may label the student in crisis as a behavior problem. This can lead to the student receiving discipline instead of true support that they need. As the behaviors continue to progress due to lack of support, so does the gap in the achievement of the student academically. If educators will look at the whole child and see the behaviors as a response to something bigger, they can begin to assist the student in handling things in a more positive way. Research conducted by Penn State University in 2017 and also by Hamilton Dawson Steiner in 2019 states that by teaching students social and emotional learning strategies, educators can see a decrease in aggressive behaviors and an increase in self-coping abilities at the early elementary education level. When students can control their emotions through social and emotional learning strategies, the learning environment for the student in crisis and their peers will improve. The sample for my study would consist of 12 students, 4 from each grade level pre-K through first, selected due to behavior and discipline records. A random sample will not be used for this study due to the target demographic being those that exhibit aggressive, disruptive behaviors in the classroom. If students are used that do not present with behavioral issues, there cannot be a true representation of how the coping strategies taught affect behaviors compared to students that have not been taught coping strategies through social and emotional learning. From this pool, the students will be placed into alphabetical order and then numbered 1 through 12. This will help to ensure their privacy as well. The even-numbered students will be placed into the treatment group, and the odd-numbered students will be placed into the control group. This study will be conducted through observations using frequency and antecedent behavior consequence charts to document data and observations. This study involves little to no risk to participants. Informed consent will be required from parents of minors. To protect the identity of the students, all participants will be assigned a number to ensure that their test results remain private. The focus of the study will only be grades pre-K through first. These students will benefit the most, I believe, from participating in the study, as they can carry the skills on longer that they learn at the elementary level on throughout their academic careers. The accessible population at my target school that I would conduct the study at consists of 65 students in grades pre-K through first, ranging in age from 4 to 7 years old. This population is made up of 92% Caucasian children, 3% Latino, 5% African American. Within the 65 students, 18% have an individualized education plan for developmental delays, speech, occupational therapy, and/or physical therapy services. The data that needs to be collected for the study includes observations of student behaviors and their triggers, how often these outbursts are happening, and if they disrupt instruction when they do. Data for which social emotional learning strategies, if any, that were used and the outcome of implementing them or not, should also be documented. Student grades will also be recorded into the study to observe if social and emotional learning strategies have any effect on the student's grades. The reliability and validity of this instrument falls on the observer. All observers will be given the same frequency and antecedent behavior consequence charts to use as observation tools, and they will also be trained on how to use them to increase accuracy and consistency in the data collected. Also, observers will be provided with training on social and emotional learning strategies and how to implement them. They will be given a common list of strategies to use in the study to ensure consistency as well. An antecedent behavior and consequence chart will also be used to track when the social and emotional learning strategies are used. This will allow for an observer to document the preceding behavior and what it was, the SEL strategy used, and what the result was from using those strategies, whether it helped the student, didn't help the student, or increased the problem. Collaborative for Academic, Social, and Emotional Learning 2021 states that through social and emotional learning strategies, students show improved academic performance and develop lifelong skills. And that is also what I predict would happen if I were able to carry out this study in my school. When self-regulation skills are taught at the early elementary age level, students develop necessary tools to handle frustration and anxiety. These skills can benefit them through the rest of their lives. DOS 2019 states that teachers using SEL strategies within their classroom have seen improvements in core content areas as well. Teachers that see the most success with social and emotional learning strategies in education add it throughout the day in all areas of instruction, and not just a set time that's solely for teaching social and emotional learning strategies in all of the studies that I researched. Teachers in studies have seen greater improvements in student behavior using social and emotional learning strategies than using other strategies and programs adopted by other districts. Hamilton, Dawson, Steiner surveyed principals and educators on their experiences with social and emotional learning in their schools. Most of those interviewed saw positive effects on student engagement, behaviors, and achievement once social and emotional learning strategies were implemented into the curriculum. In this study, they identified 3 domains for social and emotional instruction: cognitive skills, emotional competencies, social and interpersonal skills, and those results were shown in the previous graph. Merlada 2010 discovered that social and emotional learning strategies not only had a positive effect on students directly participating in the study, but also the school climate as well. Through student use of strategies and teachers collaborating with all stakeholders, schools that were the most troubled and underscored in state testing areas began to perform at a higher level through modeling and consistent use of strategies. Throughout research, a consistent thread was discovered. Students show a need for social and emotional learning when they lack the necessary tools to process stressors and self-regulate emotions. The inability for early learners to regulate independently is tied back to a few common factors throughout the various studies that I researched. Students living at or below the poverty level, in single-parent homes, or from a minority group or identified as having a learning disability run a higher risk of needing social and emotional learning support. These studies many times also slip through the cracks These students also slip through the cracks or are labeled as discipline problems as they progress through their academic careers because they were never given the appropriate supports at the early elementary level. By providing necessary tools for self-regulation through social and emotional learning strategies, educators can prevent that from happening to our students. Thank you for listening to my presentation.